Patrick J. Baggot, MD, commonly known as Patty, OBGYN in private practice. He is also board certified in maternal fetal medicine and medical genetics.
Did I do it in an hour?
Okay, I do have many degrees, but the only thing that would be really important to my mother is this one. All right, so I actually, I'm a pro-life OBGYN and do naprotechnology, so I do not do in vitro fertilization or any of the alphabet soup of procedures prescribed by the Catholic Church. So on the talk that I'm going to give, I don't really have any personal experience. However, Sister Paula decided that I would give this talk, and so therefore, I will. Oh, Dr. Shu, maybe you can advance the slides for me. Okay, see? Just hit page down, or page up as the case may be. Okay, go. All right, I'm going to sort of be a little bit brief. All right, so this is the plan of the lecture. I'll discuss what I think are the hazards of egg donation, review normal ovulation in brief form, review egg donation, acute hazards, chronic hazards, and moral hazards. And then there's a video that I would highly recommend to everybody. I really knew very little about this topic until I went through the video and started talking to some of the people who were on the video. And so I'll show you a bit of that, and then I'll be done. Okay, next. Okay, in normal ovulation, the brain sends hormones to the pituitary, which makes hormones for the egg, for the ovary. And most importantly, FSH is the follicle or egg stimulating hormone, which stimulates the growth of eggs. And in normal ovulation, you would have maybe hundreds or maybe 1,000 eggs that would try to ovulate each month. They would compete with each other, and only one egg would actually succeed because each growing egg makes estrogen, and that estrogen suppresses the other eggs. And so it's a competition. So each egg in growing itself suppresses the others. And so there's one dominant follicle or one dominant egg. And so in the plan of the Creator, a single cell is directing the female functions of the entire body at the time of ovulation. I always thought that was kind of cool. So each cell could have an important individual role. So therefore you make more estrogen. Finally, so much estrogen is made that the pituitary releases luteinizing hormone, which triggers the completion of ovulation with the release of egg, and so fertilization could then occur. Next. Boy, in the old days, every time you gave a talk, you would keep saying next, next. All right. With egg donation, this plan is somewhat modified. So with egg donation, we're going to take a healthy young lady selected for potentially being very smart and good shape and maybe an athlete or something. And we're going to try to get her to produce a large quantity of eggs. And then we will initially promise her about $100,000, and then in the end we'll say, oh, just $3,000. And when I say we, I'm not to imply that I do any of this stuff, which I don't. Okay, but anyway, so first they're put on this drug to cause menopause, and then they are given lots of, you might say, egg-stimulating hormones, and then the result of that is they have many eggs growing at one time, and these eggs are then triggered for release by one of these hormones, and then a procedure is done where a small operation is done. They put some needles in the ovary, and they suck out or aspirate each of these eggs. And if it's really successful, they might have 10 to 30 eggs. So remember, I just said a minute ago that one egg was involved in all the female functions of the adult. So now, instead of one egg, we have 30 eggs all doing the same thing. Okay, next. And so the result, and what I would think of this is, the result is you have too much estrogen. Instead of having one egg making estrogen, you might have dozens of eggs making estrogen. So if we had the thyroid that was overactive, the thyroid would overstimulate you, your heart would beat too fast, you'd get heart failure, cardiac arrhythmias. This would be a very serious medical issue. So that was called thyroid storm. And I would think that this is sort of an analogous concept. This is estrogen storm. So when the ovary is overstimulated and there are too many eggs making too much estrogen, you have all these problems that we're going to discuss. So that's called ovarian hyperstimulation. So there are leaky blood vessels. The fluid leaks out of the blood vessels, so you have third spacing. That means accumulation of fluid outside the blood vessels. Weight gain, multiple organ failure, abdominal distension. Death is possible, and depending, the numbers are somewhat variable, but some textbooks would say severe ovarian hyperstimulation would be 0.1 to 0.3%. Next. So it would be an uncommon but critical illness in ovulation induction, resulting in abdominal pain, distension mean bloating, nausea is a symptom of estrogen, as is vomiting, and ovaries 12 centimeters. Could you imagine having a 12 centimeter ovary? I mean, that's rather large. And then you would have two of them in ovarian stimulation. Fluid would accumulate in the abdomen, which we would call ascites. Fluid would accumulate around the lungs, we would call that pleural effusion. Fluid would accumulate in the lungs. We would call that pulmonary edema, and that becomes a problem because when the lung tissue is waterlogged, it requires more effort to breathe because the lung tissue is too waterlogged. And you could have kidney impairment, kidney failure, liver impairment. So multiple organ failure, next. Leaky capillaries. So when you have leaky capillaries, outside the blood vessels there's too much fluid, and inside the blood vessels there's not enough. So volume depletion. Tension ascites means when you have so much fluid accumulating inside the abdomen that the skin of the abdomen is about ready to burst. Pleural effusion, we mentioned that. You have various cardiac problems. If there's too much fluid leaking out of the blood vessels, you could have less fluid coming back to the heart, decreased cardiac output, so that could result in certain types of cardiac failure. Decreased blood flow to the kidneys could result in decreased urine output and eventually kidney failure, liver failure. Okay, multiple organ failure. So this could be very serious. Next. Now, as I said, or as I said, I think that this could be thought of as estrogen storm, and then there are other characteristic problems that you get from having too much estrogen. Some of the blood clot or thromboembolic or blood clot problems, we have seen those with, estrogen-containing birth control pills or any symptom with excess estrogen. So blood clots, you could have thrombosis or clots of the brain arteries, and that could result in stroke, paralysis. Hemiplegia is when you can't move one half your body, or even death. In one case, a limb clot. Now, you could have two types of limb clots, an arterial limb clot, which could result in amputation, that has been reported in the literature, or a venous or vein lung clot called deep vein thrombosis. And when those deep vein thromboses occur, the clot can fragment in the leg, get mobilized to the lung, and when those clots land in the lung, that's called a pulmonary embolism, and then the problem would be you can breathe, but no blood's going to your lung. That's a very serious problem. That could result in death. So these are rare, but they have been reported. Okay, next. There, and you can have, okay, now this is a lady by the name of Jacqueline Rushton. She was the daughter of Angela Hickey, and this patient, Jacqueline Rushton, she had in vitro fertilization and ovarian hyperstimulation. So she was not an egg donor, but she gave an account of what it was like for her daughter to have ovarian hyperstimulation, which winded up in death. So I'm going to recite her account here. So first her ovaries were shut down, causing menopause. Then they gave her strong ovarian stimulants. The estrogen level was excessive. So this number here is 3 times the excessive upper limit of normal. There was a large number of eggs. I think it was about 30. They gave HCG. They shouldn't have done that. And so going into it, there was an 80% risk ovarian hyperstimulation. Next. She spent a week in bed. The abdomen was painfully distended. She was unable to walk. I mean, imagine this is a young lady, young enough to be trying to get pregnant. She can't walk. 33 eggs were obtained at retrieval. She was so sick that they decided not to implant the eggs. They put the eggs in a freezer. So that was maybe one of the few smart things that they did on this case. Another daughter phoned mother and said she can hardly talk. She looked frail, sick, and terrified. Next. Her mother feared that her daughter was going to die. The daughter couldn't eat, drink, or sleep. She was nauseous. The lungs were filled with water. There was labored breathing. She was on a lot of oxygen. Despite all that, she was blue from lack of oxygen. She was moved to an ICU and then transferred to another hospital, and reportedly that there was tear in her eyes and she was cold with an oxygen mask on. Next. She continued to deteriorate. She was on a ventilator in a drug-induced coma and was thought to, at that point, look like a waxen doll. She crashed, was revived with adrenaline. 2 liters of fluid were removed from around the lungs. That's quite a bit. There's not really supposed to be hardly any space in there. Next. The mother said that there were 5 holes in the lungs with multiple chest tubes. Kidneys were failing, heart failing, fixed pupils from brain damage. Finally, she expired, and the embryos were baptized and buried with her. And so imagine before that, someone had to ask the question, well, what are we supposed to do with the embryos? So let's hope we don't get into that situation. Next. All right. So that was one of a more extreme case of ovarian hyperstimulation, but less extreme cases than that are not that uncommon. Other possible complications of ovarian harvest, you could have torsion, which means twisting of the ovaries, and that could result in possible loss of the ovary. In the videotape, there's a young lady who, one of the arteries to the ovary, if the ovary is growing like crazy, then that blood supply has to also be growing like crazy, and that means the arteries are larger than they would usually be. Next. And so if you would nick one of those arteries with the needle that you're using to aspirate the eggs, that could be more excitement than you really want. So, so apparently about 30% have some degree of hyperstimulation of the ovaries with egg donation. 12% have moderate to severe. This is a survey. This is a survey of young ladies who had previously gone through egg donation, so they're recounting their experiences. And some said that they subsequently had menstrual problems, and some had new onset of infertility. Now, virtually all the young ladies who would become egg donors have not really tried to get pregnant in the past. So maybe they were infertile to begin with. Maybe their infertility had nothing to do with the fact that they were egg donors. Next. But as I thought about this, I thought, what would be the biggest and most convincing risk of this procedure? And so as I thought about this, I thought about abortion. Abortion causes breast cancer. And why does abortion cause breast cancer? Because in early pregnancy, you make lots of estrogen, and you have lots of estrogen symptoms. You have PMS. There's more PMS in early pregnancy than there is before a menstrual period. They have, they get depressed, they get nauseous, they're vomiting. So these are symptoms. So there's a lot of estrogen which is made in early pregnancy, and in later pregnancy, you make lots of progesterone. The lots of estrogen in early pregnancy causes the breast to grow like crazy, and that's why you have breast pain. But the progesterone of later pregnancy matures those breasts, so the overall effect of a pregnancy is to reduce breast cancer. But if you only had the estrogen-driven first part of the pregnancy, like you had the first part of the pregnancy and then you had an abortion, then having a period where the breasts grow like crazy and don't subsequently mature, that's a setup for breast cancer. And so there's been numerous literature that I think was probably covered by Mary, that excessive estrogen in the pregnancy situation with abortion could cause breast cancer. So now let's think of that model, and then let's ask ourselves, what would happen in egg donation? Is there going to be a pregnancy following egg donation? Not really. So you take a lady who's been selected for high intelligence, athletic, and all this stuff. So her ovaries, if her ovaries are as healthy as the rest of her, they could produce a ton of estrogen. And in fact, they do. And then if they don't get pregnant after producing a ton of estrogen, what's going to be the result of that? Maybe that's going to make them setups for breast cancer. And how long would it take us to find out? 30 or 40 years? So it may be that it'll be a long time before we really know the risks of egg donation. Let's go ahead. Let's go ahead. Let's go ahead. All right, I sort of already said all that. Okay, let's go ahead. All right, so there have been studies on do women status post egg donation get cancer? And so according to this study by this lady, there is evidence that they have increased risk of breast cancer, endometrial cancer, cancer at any site, malignant melanoma, and non-Hodgkin's lymphoma. Probably this is a very early field, and if we would revisit this issue 30 years down the line, my guess is that we're not going to be worrying so much about these other cancers, but my guess is we're going to have a heck of a lot of breast cancer to deal with. Next. Okay. I think I'll skip this one. Okay, let's go ahead. All right, so now I'm going to play the video from the exploitation. And in the video, you'll see a few women that will recount their experiences with egg donation complications, and the ones that I would really ask you to pay attention to would be one young lady who, if you're a successful egg donor, then they'll ask you back and pay you more money. So